Okay, this is for chapter 22. This is the third chapter in your online content that will be tested over this week whenever you decide to take the test. Again, if you're just listening to the beginning, I mentioned for chapter 12 that I will have the computer lab open on Wednesday afternoon if you want to come there and take the exam. Since we're using a new format, or you're more than welcome to try it at home. Just shoot me an email if you would like to come to the lab in the Pike building to take the exam over there. That way I can be there to answer any questions and help. That is strictly up to you all. Otherwise, you can complete it at home. This chapter here is for complementary and alternative therapies, and I cover this just strictly because it is covered on NCLEX. It does ask some questions, or it can ask some questions about the complementary and alternative therapies. So that's why we're going to cover this here. So here we go. Chapter 22. Maybe. Okay, introduction. Complementary and alternative medicine. Well, before we get into it, we need to understand what the difference is between complementary and alternative. If I say complementary medicine, it is a medicine that helps medicine already there. It's used in conjunction with a conventional medication. If I say alternative, that is an alternative to conventional medication, which means you're using something that is not considered in the conventional realm of things. And an alternative medicine would be something like taking something herbal to help with a sinus infection versus taking something antibiotic driven for a sinus infection. It's an alternative. So you have to understand those differences when we're going through here. Um, Group of diverse medical and health care systems, practices, and products that are not considered part of the allopathic or conventional medication or medicine. That's alternative. And then I said contemporary is used in conjunction with conventional medication or medicine. Um, there is such thing as integrative, and that's when it combines both. Combines conventional alternative medicine and conventional medication. It combines the three together. And then there's also what we call mind body practices, and that's required a certified practitioner or a teacher, and that can be something like yoga or something along that lines. Understand if and why patients use complementary and alternative therapies or medicines. We want to understand why some people choose these, and it's normally for a variety of different reasons. But that's why we go over these, because there is some drug to drug interactions. There is some side effects that some of these alternatives do have, and we need to understand those if our patients do present with them. Assess for possible contraindications, like I said, with pharmacological therapies. Most patients in an inpatient setting do not disclose the use of these to a psychiatrist. They don't consider them medicine sometimes, so they just don't disclose that they're on them. And a thing that we have to learn about complementary and alternative medicines is their safety and efficacy is not established. These are not monitored or tested by the FDA. There's no really official guidelines or the effect use of these that are seen. So we need to look for those. Evidence-based approach, key data and systematic reviews from randomized control trials and meta-analysis. That's basically big terms, big words that says there is some research out there that shows some evidence-based approaches to some of these alternative medicines and treatments. Is recent, so we're still learning a lot about them. So we have to be open-minded to patients who use these alternatives. Some categories. You heard me mention just a few. Natural or biological basis will be your vitamins, minerals, and supplements that you can buy. And I'm talking about mind body practices. That's meditation, yoga, acupuncture, and those type of things. Some natural products that we're going to talk about, some things that you're going to see and need to understand. Melatonin. I know you've probably heard about melatonin. It's basically the thing that's found in turkey that makes you sleepy after Thanksgiving. Um, But on this slide here, you see where it says the use or possible benefits, potential adverse effects, and nursing implications. Look at these. If you notice, this also says for sleep disorder. So it tells you why that these medications are being used for these, or these alternative medicines are being used for these specific disorders. So understand melatonin is the one that you're going to see used the most for a natural product for sleep. But you do have to look, and again, here's some of the reasons why. Here's your adverse effects and some nursing implications, because here's some medications, that can interact with it, as well as safety in pregnancy has not been determined. Here's some for anxiety disorders, some kava, chamomile, and St. John's worts. Um, Chamomile tea, you heard a lot about that. St. John worts, that's carried over the counter. You can buy anywhere. But again, these are for anxiety and depression. And again, look at these big long lists of nursing implications out here. Um, so there's things that we have to understand about these. That's why the importance of saying, what do you take? Do you take any alternative medicines? Do you take any vitamins? Do you take any treatments? So that way the person feels comfortable. And again, keep that open mind when dealing with them. Here's some for mood disorders. There's the omega 3 fatty acids, SAMe, and DHEA, or SAMe, however you want to say it. And again, look at the possible or potential adverse effects and the nursing implications. We need to understand these, so make sure you read through these. Here's some for cognitive disorders: folate, ginkgo, and then or DHEA again. Cognitive disorders, again, look at your potential adverse effects and some nursing implications associated with these. If you look here under the substance abuse, sorry about that, guys. Little information available on the use of natural products with substance abuse disorders, but you want to assess the patients for use of natural disorders, including marijuana, because a lot of places don't see that as a drug, they see it as a natural product, as well as peyote, which is um, a very strong hallucinogen, as well as organic mushrooms. Some mushrooms are that way. I'm going to go real briefly through these. These are on the chart, but I'm going to touch on them a little bit. For sleep-wake disorders, we talked about melatonin. It's a hormone naturally found in the body, may decrease time taken to fall asleep at night, but variable effects on sleep duration. So this probably helps the patient go to sleep, doesn't keep them asleep. Most common side effect is daytime drowsiness, and again, there's contraindications in pregnant women and patients taking hypertensives. Valerian, again, common ingredient in sleep products. Evidence for efficacy is inconclusive. Effects on the fetus has not been evaluated. And side effects of headaches, dizziness, and GI. So you can see there's some issues with these. For sleep-wake disorder, this is what I want you to focus on too, as well as the medication. This isn't on a chart, that's why it's on the slide. Some mind-body practices that work for sleep-wake disorders, acupuncture, but again, there's not a lot of evidence to support it for treatment of insomnia, but some people it does work. Meditation, which is mindfulness-based stress relief techniques, can be associated with improving sleep, as well as Tai Chi. And Tai Chi is basically a progressive muscle relaxation where you say, you relax your shoulders, relax your arms, relax your body, and you work your way through all the way down to the bottom, and at the end you should be relaxed enough to go to sleep. Disorders of anxiety, stress, and trauma, some of the medications that's on the table that we talked about. Here's kava. It's indigenous to the Pacific Islands. It's used in a social beverage. It's a skeletal muscle relaxant, a sedative, local effects similar to cavalactones, potential hepatotoxicity, which means it's hard on the liver, and it's banned in several countries. Chamomile, you've heard of chamomile tea. It's a common herbal tea. A lot of people drink it. May have effect on the central nervous system. It's a modest analytic, sleep aid effects. May cause allergic reactions to those sensitive to some medicines in these families, as well as it does have an increased anticoagulant effect. So again, there's some issues here that we need to pay attention if our patient is taking some of these medications. Some mind body practices for disorders of anxiety, stress, and trauma. Well, you have meditation again in yoga. Meditation is cultivates the ability to moderate attention, maladaptive cognitive styles, and it's a transcendental form. Some teaches someone to relax, release that anxiety, release that stress out of their body. Yoga incorporates physical postures, breathing techniques, meditation, and relaxation to help with the anxiety, stress, and trauma. It's a controlled breathing, may lead to increased parasympathetic activity. Instruct patients to seek appropriate trained instructors. Yoga is something that you do not want to try on your own. Informed instructors of any limitations that may require modifications. And it's also been really good in the newest intervention that we've seen is with PTSD. Um, it's working well with people with PTSD because it helps them center themselves and deal with anxiety and stress that's happening in their life. We have acupuncture. May be effective on treatment of anxiety. And again, you see may, where there's not a whole lot of research out there that says, yes, this definitely works. May improve symptoms of anxiety, sleep, disruption. Also, if those with PTSD, another thing that we're seeing. It's generally considered safe. Most states require a license, though, for someone to produce or to do acupuncture. So you need to make sure if you send a patient there or request it, or someone wants to know, make sure it is licensed and has a certification to perform that as well. Some other complementary and alternative medicine that we see being used, a new one is music therapy. Music interaction involving active and receptive techniques as a mean of communication and expression. It reduces anxiety in a variety of clinical settings. There's some good research going on with music therapy right now. Has a reduction of heart rate and blood pressure. Um, and it's really unclear as to which style or type of music or duration of frequency. And it's more patient based or patient interest based when we're talking about musical therapy. Another contemporary, or excuse me, complementary or alternative medicine for anxiety, stress, again, is exercise. Depending on your physical fitness and your interest, may reduce anxiety. It's good for stress. We know exercise is good for stress. And there is potential minimal adverse side effects, and it promotes just an overall good, healthy lifestyle. St. John's wort, you saw that on the table that I showed earlier. It's hypers, hypercinin and hyperfornin is its active parts of the St. John worts that actually work on these depressive and bipolar disorders. It may be used for short term treatment of mild to moderate depression, but again, not a whole lot of research that says, yes, this is good. Yes, this is a really good, true alternative to the actual pharmaceutical medication. There's no difference in response rates between St. John warts and SSRIs in meta-analysis. So this is one of the ones that has been researched a lot. But as far as differences, there's not really seen. Similar side effects with SSRI, those anticholinergic side effects, the GI discomfort, the dry mouth, the dizziness, increased photosensitivity. Patients need to be careful when they're out in the sun. Be careful with this serotonin syndrome, and we will talk about serotonin syndrome later. But for this portion of the class, just understand if they're taking SSRIs and St. John warts, they need to be careful with this serotonin syndrome because it's actually putting way too much serotonin in their system. And it has a potential to reduce plasma concentrations in a large number of drugs. So it has some drug to drug side effects if we're not careful with St. John warts. The omega-3 fatty acids, generally safe, generally well tolerated in low dose. It does have some antidepressant and mood stabilizing effect, as well as it also helps with cell membrane fluidity, phospholipid composition, as well as affecting serotonin and dopamine transmission. SAMe or SAMe, naturally occurring compound from It's also found in ATP throughout the body. Low levels reported in cerebral spinal fluid, severely depressed patients. This, when we're testing, we're seeing low levels of this. There is limited evidence as far as monotherapy. It really needs to be used in conjunction with something else. DHEA, it's a precursor to the androgen estrogen. You'll study this when you get into OB, but it also has potential for treatments of midlife onset major depressive disorder. Um, it's got some adrenergic effects in women that's irreversible, so you got to be real careful with the doses. And reports of mania with high doses, so we have to be careful when people are taking these medications. Folate, water soluble B vitamin occurring in food. Folic acid is the synthetic form. Pregnant women are encouraged to take folic acid, but it also has potential role as a supplement treatment for depression. It's safe and well tolerated, but in high doses it also might produce seizures. Some mind body practices that we see for depression and bipolar disorder, you see mindful based cognitive therapy, um, acupuncture, Tai Chi. A lot of those are really great to help center the person and deal with the issues. Yoga, again, that meditative, that centering themselves. There is something called bright light therapy or BLT. That is not bacon, lettuce, and tomato. That is bright light therapy. Exposure to artificial light in order to stop the secretion of melatonin during the day. Effective for seasonal affective disorder. These are the people that, especially seasonal defective disorder, that we ask them to sit under fluorescent lights. It helps that body to stop producing that melatonin and they stop feeling those lulls because, again, melatonin is a sleep enhancer. So we want to stop that and hopefully stop the depression. And again, regular exercise. We all know how regular exercise can help reduce depressive and bipolar symptoms. It reduces perceived symptoms as effectively as cognitive behavioral therapy and drugs. Schizophrenia, there is not a whole lot of information out there. This is really new as far as that go. Little evidence support these supplements, but there is some small amount of evidence out there that says the omega-3 fatty acids can have some effect on schizophrenia. But again, it's more for the depressive symptoms of the schizophrenia and not the actual psychosis or the psychotic part effect of schizophrenia. Music therapy is one of the newest ones that's been out there, in addition to standard therapy that we've been seeing the most promise with and helping with individual with schizophrenia. You can use exercise and physical therapy, but however, there is normally a lack of motivation when it comes to that. Neurocognitive disorders, ginkgo biloba, y'all know how to pronounce that. I'm not even going to try that again. I butchered it too bad. But anyways, this is native to Asia. You see this advertised on TV a lot. Again, it's evidence for use in dementia, cognitive impairment, but it's inconsistent. There's no true research out there that says this actually works. Some people it works for, some people it don't. Some adverse side effects, GI complaints. Look at there, it says prolonged bleeding. Again, people with dementia are normally elderly. They normally are on blood thinners anyway. So, if they start taking this, they don't know that the side effect is prolonged bleeding and can actually, get into a lot of trouble if we're not careful and try to figure out, are people taking these or are they not. So there's a real big push, a real big importance to understand these complementary and alternative medicines. DHEA, decline associated with cognitive impairment. Again, this is something that we see declining in patients. Clinical evidence, however, does not support improvement in cognition with supplement. Even though this is something we see that's decreasing, we don't see improvement if we give it back to them in the form of a synthetic medication. Mind body practices, again, neurocognitive, there's exercise, aerobic exercise increases the hippocampal volume and improves spatial memory. Yoga, Tai Chi to reduce dementia risk, meditation. Chronic alcohol users, when we're talking about complementary and alternative medication, because they are at such a risk for that vitamin B deficiencies. Um, you can try to supplement with that, but however, the over the counter is such a long time in getting in the body, it typically don't help. The big thing here, since there's not a whole lot of medications to help treat, we need to ask what you take that's natural. A lot of patients think natural products such as marijuana is natural, so they don't need to report it, or peyote, but we need to ask about those. Some things that work that we can see with substance related addictive disorders, some mind body practices, meditation, relaxation. A lot of research out there that says acupuncture actually helps with the cravings associated with the addictive behaviors. Some implications for nursing. Now that I kind of breezed through that really quick, you need to be non judgmental and unbiased when patients talk about using these complementary and alternative medicines. Um, don't necessarily say that you have to go along with them, but you need to be unbiased and unjudgmental in their decision to use them. Sorry, guys. You need to ask about herbal and dietary supplements because a lot of people will take it thinking it's a vitamin and they don't actually think it's a drug. So it's a supplement, and that's actually how it's marketed. So you need to ask, do you take any herbal or dietary supplements? Because if you look, about two-thirds of adults did not use in accordance with evidence implications. Somebody will say, oh, I was at Walmart and I picked up this um, herbal medicine out there and it has helped me immensely for da 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 problem. But when you really look at it, it's not for that da 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 problem, and it could cause problems elsewhere. And there's a lot of drug to herb combinations that causes some complications there. So you have to be really, really careful. Be careful with some culturally competent care. Um, you can see there's some things mentioned, but read about those in your book. Don't really dive on those. But what I want you to focus on is complementary and alternative medicine therapies may particularly interest patients who do not respond to treatment. And it could be something culturally driven, or it could just be something they're not responding to treatment, and they really want to try to use those. So that's really all you need to know out of 22. What I really want you to focus on there is the medicines and the alternative mind body treatments that's out there. But other than that, that's good. You should have that down.